Good evening, doctors. I am Dr. Pravin Banodkar and I am a practicing consultant dermatologist at Skinfay Hospital and SRCC Children's Hospital, and I am also a founder and director of Dr. Banodkar Skin Crest Clinic located in Mumbai. I am going to be speaking to you about oral ceramosides. We all know that oral ceramosides are oral moisturizers. This is a very new concept, a newly researched concept worldwide, and now available in India as well. Dryness of the skin is characterized by breakage of the skin barrier. We are aware that the skin barrier has a number of keratinocytes. It's like a brick pattern where you have keratinocytes, which are the bricks, and in between the bricks there is a lot of ceramides and intercellular lipids. Any damage or deficiency of this intercellular lipids or ceramides results in increase in the transepidermal water loss, and this can cause dryness of the skin. This breakage of the intercellular barriers is seen in particular conditions like atopic dermatitis, in psoriasis, in contact dermatitis, and a number of other frictional dermatosis as well. The damage to this skin barrier function results in increase of transepidermal water loss. The water cannot be retained in the stratum corneum, and as a result of which the skin becomes very dry, and then you get symptoms of dryness, itching, scaling, and even redness when inflammation sets in. So if we treat this barrier dysfunction, we can help in improving the skin conditions. We are all aware about the application of moisturizers, which are of different kinds, of humectants which retain the moisture in the stratum corneum, the occlusive agents which help in kind of retaining or maintaining the moisture in the skin, and then you have the emollients, which are surface correcting agents like soft cement. They help in covering or smoothing out the skin. Ceramides are available as local topical applications as well as oral intake. Topical ceramides help in kind of covering the barrier of the skin, and they help in maintaining good moisturization capabilities. Oral ceramosides are plant derivatives. These are safe, they do not have any side effects, and they help in retaining the moisture of the skin. There is a lot of research going on globally as well as in Japan and many other countries about the role of oral ceramosides in a number of these dry conditions like atopic dermatitis and psoriasis and many other medical dermatosis. I personally have a good experience in the use of oral ceramosides. I use them both in children as well as in adults. In children it is available as a syrup format, and for oral there are capsules available. Now this can be given on a daily basis. I have not seen any side effects in my experience. I have given it to a number of patients of atopic dermatitis, of psoriasis, and many other dry skin conditions. One more observation which I have seen is when I have put the patients on oral ceramosides, the need of or the burden of corticosteroids or other non-steroidal calcineurin inhibitors reduces. This could be happening because the oral ceramosides, they improve the barrier function of the skin and they help in reducing the number of flares seen in atopic dermatitis and psoriasis. I have used it even in children having erythroderma, and over a period of time during the maintenance phase, after the initial erythroderma had come under control, the patient was well sustained with the use of oral ceramides as well as topical moisturizers. The number of flare-ups which the child used to get earlier when he was not on oral ceramides was dramatically reduced. This could be a contribution because of an adjuvant therapy of oral ceramosides. So oral ceramosides, I would place them as an adjuvant treatment, as a supportive treatment to our main line of therapies of topical moisturizers and topical steroids or topical calcineurin inhibitors. They help in reducing the number of flare-ups, they help in reducing the quantity of the drug like topical corticosteroids or oral corticosteroids or topical calcineurin inhibitors which the patient might be put on. They are quite effective. They do not have any side effects. In my personal experience of using it over the last 2 or 3 years, I have not seen any side effects which are significant or that need to be reported. Similarly, I did a literature review. A lot of evidence-based medicine and expert 5 reviews are there which show that there is not much of a side effect profile with the use of oral ceramosides. Ceramosides do not have any drug-to-drug interactions. They can be safely used in both pediatric as well as the elderly geriatric age groups. They do not have any sedation and neither do they have any gastrointestinal side effects like nausea, vomiting, which can be seen sometimes with other oral vitamins or supplementations. So overall, I would place ceramosides given orally as more of an adjuvant therapy which can be given along our main line of treatments of corticosteroids and topical calcineurin inhibitors. They do reduce the number of flare-ups of atopic eczema and dermatitis. They can be contributing by adding to the improvement of the skin barrier dysfunction. So this was an overall experience of mine in the use of oral ceramosides. They are can be and used for a larger number of patients. We can probably even promote a number of randomized controlled trials to get more data in Indian population. So thank you very much and have a good day.